Welcome to Aesthetic Art. Dr. Maya Kato is board certified by the American Board of Otolaryngology, Head and Neck Surgery, and has performed thousands of procedures while keeping safety at the forefront.
The American Society of Plastic Surgeons keeps a database on the number of procedures that are done every year. What we know from this data is that the number of surgical procedures, cosmetic surgical procedures that are done has plateaued. However, the number of cosmetic injectables has increased exponentially. This tells us that the patients are looking for something that they can have done that is in the office without the downtime and risks of surgery. But this being said, although these injectables are widely popular and for the most part they are safe, I think it's better to say that they are safe if done using proper technique. And it is very important that the injector be properly trained, the credentials of the injector is very important, and that they know their anatomy. Because even though we do thousands of these procedures every week, every month, and they're done safely, every once in a while there's a report of an adverse event. And typically those adverse events can happen if somebody doesn't know their anatomy and they've injected filler, say, into an artery. And on very rare occasions, the consequences of this happening can be severe. It can lead to loss of skin on the face and even blindness. So I think it's very important in my practice that every time I'm doing a procedure on a patient, I'm exceedingly mindful of where the anatomy is and making sure that I place the injections into the proper plane and the proper area so that my patients stay safe and we avoid any adverse outcomes. Choosing your injector is very important. I think that the injector and the patient need to have the same aesthetic vision for their outcomes. But I also think it's important that when patients choose an injector, they are choosing somebody who is knowledgeable and properly trained. You also want to make sure that your injector is using bona fide FDA product material, because there are cases in which patients have been injected with material from another country that is not sterile, and they get into horrible problems with infections and possibly even worse. So you want to make sure that you're being injected with only FDA approved Botox or filler or whatever the substance may be. A lot of people will research the product or perhaps the dollar cost, but I think what's even more important than doing that is researching the injector and knowing what their credentials are and what their training is and what products they will be using. Because we're talking about your face, so you need to know your provider.
Call Aesthetic Art today at 760-610-5558 or visit us online at drmayakato.com to book your complimentary consultation with Dr. Maya Kato.